Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a fascinating area of equine veterinary medicine, focusing on a common cause of lameness in horses, distal tarsal joint osteoarthritis. This condition, often referred to as bone spavin, affects the lower hock joints, specifically the tarsometatarsal and centrodistal joints. It's a significant issue that can greatly impact a horse's performance and quality of life.
That's right, and traditionally, treatment for this type of lameness has primarily relied on managing the symptoms, often through the use of anti-inflammatory drugs. Corticosteroids are frequently injected directly into the affected joints. While they provide pain relief by blocking inflammatory pathways, they also have potential negative effects, such as inhibiting the joint's natural repair mechanisms and potentially increasing the risk of further damage to the cartilage or even catastrophic musculoskeletal injuries, particularly in high-performance horses like racehorses. These concerns have led to growing interest in exploring alternative regenerative therapies.
And that's where the study we're discussing today comes in, titled Allogeneic chondrogenic-induced mesenchymal stem cells for the treatment of tarsometatarsal lameness in horses. This research investigated a specific type of regenerative therapy. It looked at the efficacy of commercial intra-articular blood-derived allogeneic-induced mesenchymal stem cells, or chondrogenic-induced mesenchymal stem cells for short, for treating tarsometatarsal lameness in horses. These stem cells are cultured in a way that encourages them to develop into chondrocyte, the cells found in cartilage, which are then attracted to damaged cartilage tissue. The study aimed to determine the effect of this treatment compared to using intra-articular corticosteroids in horses with naturally occurring lower tarsal joint lameness.
This was a retrospective study, meaning they looked back at medical records. They identified horses presented to a single referral center for tarsometatarsal joint disease over a 4-year period. Horses with bilateral tarsometatarsal lameness were selected. A total of 167 adult light breed horses met the inclusion criteria after excluding those with concurrent lameness or lack of follow-up. Diagnosis was based on subjective lameness assessment before and after diagnostic analgesia, specifically blocking the tarsometatarsal joint, and graded radiographic examination. Allocation to the two treatment groups was based on owner preference, not randomization.
So, how were the groups divided, and what were the characteristics of the horses involved? Records from 67 horses treated with chondrogenic-induced mesenchymal stem cells were analyzed and compared to 100 horses treated with corticosteroids. The horses had a median age of 9 years, and there were no significant differences between the two groups in terms of their signalment, which includes characteristics like breed, sex, and use, or their radiographic grade of osteoarthritis. Interestingly, the horses in the chondrogenic-induced mesenchymal stem cell group were considered lamer overall at presentation, which was a statistically significant difference. The median lameness grade at presentation was 2, ranging from 2 to 4. Radiographic grading, which assessed variables like periarticular modeling, subchondral bone lysis, subchondral bone sclerosis, and joint narrowing, showed a median grade of 5, and there was no correlation between the lameness grade and the radiographic grade in this study.
Now, let's get to the results regarding the clinical outcome. All horses in the chondrogenic-induced mesenchymal stem cell group and 79 out of 100 horses in the control group treated with corticosteroids initially went sound after treatment. Owners reported no detectable adverse reactions to treatment in either group. The first re-examination occurred around 38 days post-treatment, with no significant difference in timing between the groups. The median time that horses remained sound after treatment was substantially different. Horses treated with chondrogenic-induced mesenchymal stem cells were sound for a median of 336 days. In stark contrast, the control horses treated with corticosteroids were sound for a median of 90 days.
That's a huge difference in duration of soundness. The study highlights this by looking at the recurrence of lameness. Lameness symptoms recurred in 86 out of 100 control horses, which is 86%. However, in the chondrogenic-induced mesenchymal stem cell group, only 17 out of 67 horses, or 25%, experienced a recurrence of lameness. This means the success rate for horses remaining sound was a 75% for the chondrogenic-induced mesenchymal stem cell treatment versus just 14% for corticosteroids, a statistically significant difference.
The statistical analysis further supports this finding. Using survival analysis and Cox proportional hazard modeling, which controlled for factors like age, breed, sex, lameness grade, and radiographic severity, the hazard ratio for treatment was 8.35. This indicates that horses treated with corticosteroids were more than 8 times more likely to have lameness recur compared to those treated with chondrogenic-induced mesenchymal stem cells. Within the control group, 2 different corticosteroids were used, triamcinolone acetonide and methylprednisolone acetate. The study found no detectable difference in outcome between these 2 specific drugs.
Moving into the discussion, the authors interpret these results as demonstrating that, in a clinical setting, intra-articular treatment with chondrogenic-induced mesenchymal stem cells resulted in long-lasting soundness in a high proportion of horses with naturally occurring tarsometatarsal lameness when compared to corticosteroids. They discuss the proposed mechanisms. Corticosteroids inhibit the painful inflammatory pathways but also negatively impact cartilage homeostasis, potentially hindering any natural repair. Mesenchymal stem cells, on the other hand, also modulate inflammation but are believed to be attracted to damaged tissues like cartilage, potentially offering an alternative repair mechanism. The observed benefits in this study support findings from previous preliminary studies on intra-articular mesenchymal stem cells in horses.
However, the authors are also very clear about the limitations of the study, emphasizing that these must be kept in mind when interpreting the results. As a retrospective study, it wasn't blinded to the owners or clinicians. The significant cost difference between stem cell treatment and corticosteroids, while mitigated somewhat by insurance in many cases, could introduce bias. Owners might have been more inclined to report positive results for the more expensive treatment, and clinicians could have been tempted to overlook mild lameness in these horses. Also, the rehabilitation protocols differed between the 2 groups, with stem cell-treated horses following a longer, more gradual return to exercise based on the manufacturer's recommendations, while corticosteroid-treated horses had a shorter rest period. This difference in recovery plans is a significant potential source of bias that cannot be excluded.
Yes, there were other factors to consider too. The commercial chondrogenic-induced mesenchymal stem cell product contains excipients like dimethyl sulfoxide and allogeneic plasma, which, although present at low levels considered insignificant, might have some influence. The study also only injected the tarsometatarsal joint, not the centrodistal joint. While local anesthetics and corticosteroids are known to diffuse between these joints, it's unclear if mesenchymal stem cells do the same. Furthermore, the diagnostic methods used, primarily subjective lameness assessment and 2-view radiographs, have limitations. More advanced imaging techniques like scintigraphy, computed tomography, or magnetic resonance imaging were not used, which might have identified other potential sources of pain or specific pathologies. The study also confirmed the long-standing observation that radiographic severity does not always correlate with the degree of lameness in distal tarsal osteoarthritis.
So, while the results are promising, showing significantly longer soundness with the chondrogenic-induced mesenchymal stem cell treatment compared to corticosteroids, the retrospective nature and potential for bias, particularly related to blinding, rehabilitation, and diagnostic limitations, mean these findings should be interpreted cautiously. The study does highlight the potential of this regenerative therapy. However, the authors indicate that further studies are needed to refine patient selection methods and confirm these findings in a more controlled setting.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.